Hi.
Hi, how are you?
Hi, Dr. Christine. How are you? Thank you for being on my live today.
Thanks so much for having me.
I'm so sorry. I really wanted this to happen a while back. Forgive me for the delay. It's just that I had a baby, and my life is still upside down.
Well, I honestly can't believe that you just had a baby. You look amazing. So whatever
Uh,
you're doing, keep
This
doing.
this is an amazing filter on Instagram. I'll teach you later.
You need to tell me about this filter.
I actually made one that fits me. That's how severe I need it.
Wow. Okay. I need one of these. My
Hope you're
lighting is
well.
horrible.
How you're in New York right now, right?
I am in New York, yeah.
How's it going? How's the weather? How are things?
It's starting to get a little cold, but not too bad. It's still like, not heavy coat weather, which is good. So
By the way,
I'm
I
in.
studied in Boston, so right next door, and New York used to be like my hub when I was younger. And I actually before COVID used to come to New York twice a year. So I
Wow.
simply love that city, and I even love it more than Boston, where I lived for like 6 years. But
I must say, New York is not unlike any other city in the world. So
it's
definitely,
amazing.
yeah.
So I want to thank you for being here. And honestly, I think it's a really good topic to discuss. I know you studied internal medicine and you also have certification in also in weight loss as well. And you created your amazing platform, which is called From Within, which specializes in many aspects for women in terms of skin. I've been actually looking at your page and about Morphus and weight loss, and you're like you do so much. So how did you, let's first give us a brief about you, tell my followers and
Sure. Yeah,
about
absolutely.
how you started
So,
medicine. Yeah.
yeah, my background is internal medicine, as you mentioned, and I love internal medicine, and I've been practicing it for almost actually 22 years. But I noticed that as an internist, I wasn't really getting the opportunity or the time, frankly, to discuss preventive measures and nutrition-based measures with my patients. And it really bothered me because I've always been really passionate about nutrition and how it affects not only the way we look, how we feel, but it really just affects our mood and our cognitive function too. So, and I didn't want to kind of like jump into starting my own practice while my children were still young. So now they're all teenagers, so I have a little bit more time. So a couple of years ago, I opened my practice and I named it From Within Medical, basically because our body is, in my opinion, the best healer and the most amazing healer, and we can really heal from within. We just have to be given the right tools and education and knowledge to be able to do that. And so that's what I really focus on. In terms of gut health, in my opinion, gut health is the start of all chronic
No
illnesses.
problem. True.
Yeah. And so, I really start there. We look at the gut. But then, as you mentioned, beauty, we all want to feel good, but we all want to look good too. And we have so many technologies now, like you said, the Morpheus microneedling, for example, where we can really stimulate collagen naturally without having to do invasive procedures, or PRP, which is platelet rich plasma, which is our
I love
own
it.
blood. Yeah. Do you know PRP?
Yeah, I do it. I actually do it a lot, but I'm going to ask you a question since we're at it.
Yeah.
I actually do it for my hair, and
Yep.
I do it for my face. And recently, this lady told me, by the way, if you have any history of cancer, you shouldn't be doing PRP injections because it has to do with your blood or something. Is it true or
I
no?
I haven't heard that.
Yeah,
And
me neither.
yeah, I mean, if you think about it, it's your platelets, right? And your platelets are really rich in growth factors, like collagen and elastin. So I think it's a great procedure to do to just stimulate your own healing mechanisms. I have not heard any relationship to
Yeah,
cancer,
me too. So this
but
is
I'm
why I
going
was
to
like, this is the
research
first
that and
time.
actually get back to you and let you know about that.
I don't feel she was very relevant. So I was just asking you because I've never heard it before and I've always done it all my life. I
Yeah.
think I would have heard it and I'm very into this field.
I'll
Um,
definitely research it. I call it nature's filler, right? Because it's natural, and
yeah.
a lot of people do it in replacement to filler. And I've had a lot of people start to really request it now, which is great because it can help with so many different things.
And you
So
also do aqua gold, right?
I do aqua gold also, and the beauty of that is you can put anything in there that you want. My most popular is putting glutathione in there, which is it's actually an antioxidant similar to vitamin
Yeah.
C, and it brightens the skin, so it's great
It
to do
also
too.
evens the skin tone, right?
It
It's for
really
people that have
does.
pigmentation. Yeah.
Absolutely.
But what do you think of the results? Are they long term, or you need to keep doing them, or does it?
No, they're usually short term. They usually last for a couple of weeks because what it does is it actually blocks the precursor to melanin, right? So melanin is our pigment
Mhm.
that helps with our skin color, right? So what it does is it temporarily blocks the production of melanin, and that's what gives people that glow and that bright skin. But unfortunately, it usually doesn't last more than a couple of weeks. So,
But do
but
you think it's a question, because
no,
like I just gave birth and I have a lot of pigmentation in on my body, for example.
yeah.
Would you use it as a way to stop pigmentation for like some period of time? Would it make the other areas in your body produce less darkness? Would it help with the discoloration at a certain point?
Yeah, you can definitely use it. You can get IV injections as well. But what I find is really more of a permanent a brightener and helps with pigmentation is eating foods that are rich in antioxidants, right? Because glutathione is an antioxidant, vitamin C is an antioxidant, and those are actually present in foods. So when we eat really rich foods in plant-based, like fruits and vegetables that are bright in color and you know, they'll actually give us that natural glow because our body will actually make more glutathione on its own. And as
Like
crazy as it sounds, it actually really makes a difference.
what kind
Um,
of fruits? Like for example, like bananas, no, or like
bananas, not so
apples.
much glutathione, like anything really colorful. So like blueberries, oranges, pineapples, those are really big ones that have glutathione. Any berries are really rich in vitamin C and glutathione also. So, and you know what you can do is, this is what I actually do. You make a smoothie in the morning, you throw all those in. And then if you want, there's actually, I use a powder. It's called whey protein, which helps your body make its own glutathione. So I actually put that into my smoothies, and it also really helps as well.
What is it called? It's a weight, it's a protein.
Yeah, it's a company called Celluvi. I can send you the link.
Yes,
It's really
please.
good. Yeah, because you want glutathione. You want your body making it, obviously, more than getting it from the outside, right? Because when your body makes it, then you're naturally really going to start to glow. So this whey protein that I add actually helps your body make its own glutathione, in addition to eating the fruits and vegetables.
I always emphasize pigmentation on my platform because, we're from the Middle East and
Yeah,
everybody here has issues with skin tone and pigmentation. So I always emphasize this point with any live, more than even Botox and everything, because this is something that is consistent, that I think everybody doesn't ever get rid of because of our, the weather, and just honestly, we're not even in the sun. I think it's just actually our skin tone. We scar badly and we just get dark. Bishara, by the way, are you originally Lebanese?
I'm not, but I've been asked that so many times. I'm Egyptian,
Oh,
but yeah, I think Bishara is a very common Lebanese name, right?
yeah, also, but also we have Bishara in Saudi, by the way.
Okay, see that
Yeah, you're
it's
all
famous.
over.
Yes, exactly. I agree with you on the hyperpigmentation. I think the darker you are, the more prone you are to getting hyperpigmentation without doing much. Another thing that I really like is chemical peels. Not doing them that often, but they have brightening agents and they help to get rid of the dead skin. On the surface of the face. Really,
And you do a
antioxidants though are my main ones.
And you do a peel that you can do at home through virtually. And I read about that. Tell us more about that. Like, how can you do
Yeah.
a peel at home that's virtual? And I think you came up with this during COVID for sure.
I did come up with it during COVID, and I actually got it trademarked, so it's my trademark. I use a company called VI Peel, and traditionally, it's a peel that you go to your doctor's office to do because it is, medical grade. But during the pandemic, I wanted to really kind of help my clients and my patients still have those beauty services that they wanted, and so many people were using Zoom, and they're like, I don't like the way I look. So what I started doing is I started sending them the peel. And what we do is I virtually guide you. So I screen ahead of time just to see your skin. You send me pictures. We look at your skin tone. We look at the type of skin that you have. And based on that, I'll pick a formula for you. And then I'll mail it. And then when you get it, we literally go step by step in putting it on, and I haven't had any issues at all, and everyone loves it and they get great results. And it's the beauty is you're doing it from your own home, which is great.
Yeah,
So
that's amazing. So,
yeah.
so how do you come up with the study? How did you
Okay.
decide you wanted to do the study about the relationship between COVID and gut health, and what made you link it so fast?
Another thing about staying at home and not doing as much as you're used to. I live in New York, and early on, the pandemic hit New York City pretty early. So a lot of practices that were considered non-essential, which were like non-emergent, were really closed, shut down. So my practice was actually one of them. So I found myself a little extra time on my hands that I didn't really have before. My husband, on the other hand, he's an ICU physician, so he kind of had the opposite effect. He was kind of just pushed on, he and his colleagues pushed onto the front lines right away, like in March of 2020. And they started seeing all these COVID patients in their ICU. And early on, we didn't really know much about COVID, right? We didn't really know a lot of the risk factors. And so every night he would come home and he and I would discuss his patients. He talked to me about a lot of the patients that we knew were getting really sick, the elderly, the patients with heart disease, and the patients with diabetes. But then he was telling me there's this other group of people that were in the ICU really, really sick, and they didn't really have any medical problems other than maybe just a higher than normal BMI, young people, probably not super obese, but a little bit overweight. And so they were kind of starting to try different treatments. So one of the treatments that they used was a medicine that helps inhibit inflammatory responder in our body called interleukin 6. And I'll explain this if you want. So interleukin 6 is similar to cortisol. A lot of us know about cortisol. It's like a stress hormone, and it goes up when we're stressed. Well, interleukin 6 kind of has a similar effect in that when our body is stressed, so when our body or immune system sees something that it perceives as a threat to us, so something like COVID, an infection, or anything that's a threat, our body will release interleukin 6. So in the hopes that this will actually get a lot of inflammatory responders to the site and then fight that infection. Unfortunately, what's happening though is patients who are diabetic, same people who are getting really sick, heart disease, patients who are overweight, their body is already making too much interleukin 6 because they're already in that inflammatory response chronically. So when they get something like COVID, their body can't handle it. And so he started talking to me about the medications that they were using. And then he just kind of point blank asked me one day, knowing that I see a lot of weight loss patients, he asked me, do patients who are overweight have high IL-6 levels? And I said, yes, it's an inflammatory response. And this is what we mean when we say people are inflamed, right? Like when we say that person has inflammation, it's because they have these subclinically elevated levels of inflammatory responders. So take a breath. So that being said, I kind of started to wonder, interesting. Let me do a little bit of research. And also we were really not seeing children getting sick, right? We were seeing them getting very, very mild symptoms. So in addition to my husband and I have two scientist colleagues, Dr. Sadim and Dr. Blaze, who are scientists, and they actually specialize in biological molecular pathways. So I asked them to help me kind of do a little bit of research on interleukin 6 pathways and how they affect the immune system. And interestingly enough, we started looking at children and wondering why they're not getting as sick. Well, it turns out that children actually have, we knew it was related to the gut, because children's guts overall are healthier than adults.
True.
And we know this, right?
Because you can also control their food intake at that age, and you'll know very early on. Yeah. So
exactly. And just in general, like everything new is healthier, right? But
yeah.
Interestingly enough, and it's almost like it's God's way of ensuring that they develop their immunity, or nature's way of developing their immunity. Their gut is very different from ours, and their gut microbe composition is also very different. And they mainly have a very, very high concentration of one specific bacteria called bifidobacterium. And in children, healthy children under the age of 10, 60 to 80% of their gut is this one bacteria. So we started looking at bifidobacterium because also bifidobacterium has been a very well-known microbe for years, and it's in every probiotic, and it's known It's very well known that it's very beneficial. They've used it on cancer. They've used it on patients with influenza with really good results. So we started studying the functions of bifidobacterium. Well, lo and behold, it turns out that bifidobacterium actually downregulates IL-6, which is the same pathway that is the culprit in severe COVID infections. So because it's downregulating, it's decreasing this inflammation that we're seeing. So it's not allowing children to develop this really, really bad inflammatory response to COVID, which is what's causing people to get really sick. But not only that, bifidobacterium not only downregulates IL-6, it upregulates an anti-inflammatory responder. So it's doing its job by getting rid of the inflammation, but it's also doing its job by increasing all the factors that you need to help fight any kind of inflammation. Okay. So we published this study back in May of 2020. Yeah. Initially, we had a lot of skepticism because it was not a clinical study where we were seeing patients in the hospital. It was more of a research-based review study. However, fast forward now, 20 months later, not only are there 20 scientific peer-reviewed studies in addition to ours, which was peer-reviewed, 20 science peer-reviewed studies around the world that are actually showing a link to the gut and COVID, but specifically bifidobacterium. There's a large study in Hong Kong done in January of 2021, and they actually looked at the stool of patients who are in the ICU with COVID, and they found them deficient in bifidobacterium. And actually recently,
this bacterium that they have deficiency with, it's usually because of weight gain and what other factors?
Yes, exactly. So really good question. So deficiencies in bifidobacterium occur in weight gain. They occur in people who have chronic inflammatory issues like diabetes or heart disease. Anything basically where you're depleting your gut from the proper food. So really, if you're not eating the food that are going to help build up your bifidobacterium levels, you're going to have a problem, because then you're going to have unopposed interleukin-6 elevated. And that directly correlates to inflammation in your body. And
honestly, it's so interesting to even I've also interviewed before. I don't know if you know Yalda from Eat, Burn, Sleep, who she's also all about an anti-inflammation diet. And it's very interesting how we look at these things as diet, as something very like it's a hazard and it's annoying, but it's so important to actually take these things seriously. In our part of the world, let's be like, the food is not, it's very heavy, it's very greasy, there's a lot of meat. You rarely find these, like, even if you eat vegetables, the way they cook it is with a lot of sauce. And I think the whole Middle East is like this. So it makes you realize how you should actually eat differently, because actually it affects everything. So a question I'm going to ask you, how does COVID, how does like having, you wrote me, this question is important. How does gut health affect your brain health and mental health and brain function? Because to me, I never thought it was related. I thought it was just all about your stomach always, you know?
Yeah, like I said, gut health is really the start of everything. You know, chronic inflammation, chronic disease, but also it really affects our brain health, our mental health, and the way that we function, if we're able to sleep well, if we're able to focus, it's all linked. And the way that it's all linked is we eat food, right? And so we have the building blocks of neurotransmitters, which are what help us to do different things in our body. I'll give you an example, like serotonin. Everyone knows serotonin, right? So serotonin helps with mood. It helps us to sleep. But a lot of people don't realize serotonin is primarily made in our gut. And it's made with a precursor amino acid called tryptophan. Now, tryptophan is one of the 20 amino acids that our body uses to make different things, but it's one of the 9 that actually our body cannot make. And those are called essential amino acids. And the reason they're called essential is because they're essential to us to be able to survive, but we're not able to make them. So we have to get them from food. So if we're not eating foods that are rich in tryptophan, we're not going to be able to make serotonin. And so how is that going to affect us? It's going to affect our mood. It's going to affect our ability to sleep. It's going to affect a lot of things. So this is one way that we can really help our brain and our mental health with food. So a lot of people ask me, like, well, how can I get tryptophan? Well, tryptophan is in a lot of foods, such as walnuts. Most nuts have a little bit of tryptophan. Walnuts have the most. Other foods like pineapple are very rich in tryptophan. Turkey is very rich in tryptophan. Edamame is very rich in tryptophan. So if we know that we're deficient in serotonin, for example, and this is what I do in my wellness evaluations, I'll check and see not only what your dominant neurotransmitter is, because we all have a dominant neurotransmitter.
Yeah.
So you might be serotonin dominant, right? And that might affect the way that your personality is. I myself am acetylcholine dominant, and acetylcholine is the neurotransmitter that's responsible for brain speed and motivation. So if I'm deficient in acetylcholine, I'm not really going to have any motivation to do anything. I'm going to have brain fog. So what do? Well, I have to see what foods can I eat more of to replenish my acetylcholine. So the acetylcholine has a choline membrane, right, around the neurotransmitter molecule. Choline is fat. It's a fatty layer. So how do we get choline? We have to eat foods that are rich in fat. So not bad fats, but foods like avocados, for example, have a lot of choline. Or foods like wild salmon have choline in them. So if we know what we're dominant in and what we're deficient in, we can replenish, and really, it really does affect our brain health. And,
A question, since we talked about
yeah.
fats, what do you think of the keto diet?
Okay, so that's actually a really good question. So keto is great for weight loss. It's great for maintaining weight loss. However, because keto has very little plant-based foods, overall it's really bad for your gut, because we need fibers from fruits and vegetables, because those fibers, think of them as the food for your gut bacteria. And your gut bacteria are like factory workers. So they eat that food, they digest the fiber. The fiber is live. It's food for our probiotics in our gut. And what happens after that is they eat the fibers, that's their nourishment. And then they actually make a byproduct, which is short chain fatty acids that actually help to protect our gut lining, right? Because we want our gut to be protected and not to have little leaks and barriers that are open, because that's
Like
what
leaky
causes
gut, like the leaky gut, basically.
Exactly. So, and this is actually a really good question. This is why we're seeing a lot of people who seemingly look healthy getting really sick from COVID. Like you're seeing a lot of this in the news. You have like these very muscular men or these bodybuilders, and they look really healthy, but then they get really sick, right? And they get really sick from COVID, probably because they're on a very high protein diet and very low plant-based foods that they're eating. So because they're probably deficient in bifidobacterium and a lot of other beneficial bacteria that are regulating their immune system. And I know this is very controversial to say, and I'm sure I'm going to get a lot of people like telling me,
No, by the way, everybody that is in the field you're in is very against keto, by the way. You're not the only one.
Yeah. Yeah.
I think
keto,
a lot of people,
I would say if you're going to do it for like a month to lose weight, like if you have to. But, I personally don't recommend keto. I recommend a low carb diet that includes plant-based, good carbohydrates, not refined carbohydrates, because you really want those prebiotic fibers to help your gut thrive. And that's really the key to gut health, is beneficial gut bacteria in your gut.
what
They're a
about
helper. Yeah.
what about intermittent fasting?
Yeah.
Fasting.
I'm glad you
What
brought
do you
that
think
up too. I love intermittent fasting. I've been
too.
doing it for 30 years. You too? Yeah.
It works with me because I'm not a breakfast person. I've never been. I wake up on a full stomach for some weird reason. And I'm someone that likes to eat after noon, like afternoon. For me, that works well. I don't wake up at 8 or 7. So for me, if I wake up at 9, it's very fine for me to eat at 1. So it really works for me. My only issue is that sometimes I get very hungry by the time I get to lunch. So I overeat at lunch a lot. And that's a bad thing. I need to manage. I have no portion control because I don't snack personally.
Yeah.
But I feel it works with a lot of people who snack better than me,
Well, and that's interesting that you brought that up. And what I find really helps when it's your first meal, make your first meal a smoothie. You'll find that you're not hungry for a few hours. So if you want to eat, at noon or 1, make a smoothie, put all the fruits and vegetables that I mentioned. Like if you want increase your glutathione, you can put berries and a banana and pineapple. And then I usually throw like organic spinach leaves on the top. And then you make that, and literally you're getting 3 or 4 servings already of your fruits and vegetables in one shot. And it's very filling, because again, you're getting those fibers. Yeah. So try that.
New York for that. I miss New York. I used to go to Soul Cycle in the Upper East Side, and then after that, I would go have my smoothie. and like I'd burn the calories and have my smoothie, and then like would have lunch in the afternoon. I just miss that life. Enjoy it.
You can make it at home, recreate it.
Yeah, yeah.
Yeah.
It's just that I really enjoy walking in New York. This is something
Yes.
that I really miss, you know, because here we don't walk much because it's just the setup.
Why?
You know? It's all cars. It's like LA, you know. It's
Yes.
Middle East is always mostly cars. So I just like, you know, the whole walking and blocks. That also really makes a huge difference in lifestyle. Walking, like I'm sure that you don't count your steps because you manage to get the 10,000 very easily per day. For us in this part of the world, we need to finish the 10 by putting an effort because it actually is impossible to finish 10,000 by just walking around because you don't walk that much, you know?
I agree with you. That's the one thing I love about New York is just the ability to go out and just walk.
Yeah,
And actually the 10,000 steps, they say you don't really need as much. If you get about 6 or 7,000, it's just as good.
that's
So,
good.
which is about 2 miles or maybe like close to 3 kilometers. So it's not a lot, but definitely have to make the effort to do it. Yeah.
Okay, I have another question. How does our gut leaf what's the link between inflammation and the immune system with gut? All that. Tell us about
Yeah.
that.
So we touched a little bit about that with leaky gut.
Yeah,
So
leaky gut.
again,
Because not
yeah,
everybody understands what leaky gut is. So can
sure.
you tell us more
Yeah.
about that?
Yeah. So, so as we were saying, we have all these trillions of microbes, bacteria living in our gut. And believe it or not, there are helpers. They really help to regulate our immune system, as I mentioned. So what happens if we're not eating properly and we're eating foods like, preserved foods, a lot of processed foods, or we're drinking a lot of alcohol or eating foods that are really high in sugar, artificial sweeteners. All of those things can disrupt the gut lining because what happens is they kill off the good bacteria. And when you don't have the good bacteria, they're not able to make those byproducts that I mentioned that help to heal our gut and keep our gut lining healthy. So what happens over time is the lining of the gut starts to break down slowly. And so if you think of your gut as like really strong, like network of, cells that are really tight and don't let anything out, what happens is after a while, the barriers start to weaken. And what happens is toxins that are supposed to stay in our gut and go out in the stool start to leak into our bloodstream. So our immune system is really smart. It sees these toxins that are not supposed to be in our bloodstream and it says, what's going on here? I need to protect myself. And so it releases these immune responders like interleukin 6, which are meant to help us on a short-term basis. But what happens over time, yes, over time is interleukin 6 is constantly elevated. And if it's constantly elevated, you're constantly in this inflammatory state. And your body's, it's almost like it's really fragile and it's always on alert. And that's what leads to inflammation. And that's what leads to the progression of a lot of illnesses, including a lot of autoimmune diseases. We're starting to see a link to gut inflammation and autoimmune, because autoimmune disease, what happens there is your body's attacking itself, right? It's not recognizing certain things about itself as itself. It's seeing it as foreign. So, so many different conditions that arise from leaky gut. And again, leaky gut is one of those things that a lot of doctors kind of poo-poo and they say it's not a real thing. But we're starting to see that there's so
Everybody
many.
that does internal medicine and is like what's the other field? There's a new thing in medicine right now. We don't have it in our part of the world yet. Functional medicine. People that do functional medicine are all about the leaky gut, and they say that this is the core to all diseases, and it's all about food. And I actually had a live with Will Cole. I don't know if you know him.
Yeah, I know Will Cole. Yes.
And he was talking about that, how, like, for example, if you go get a blood test at a hospital and they just tell you, oh yeah, your everything seems fine. He's like, it seems fine according to the norm, but it doesn't mean that this norm fits you. So they need to keep checking. Like, so apparently now when you do a blood test, you need to go to someone as specialized as like someone like you to actually tell them if they fall within this percentile, if this works for them or it doesn't, because apparently there's also not a one size fits all with blood tests, which is the norm in every hospital. And I'm loving the fact that a lot of functional medicine doctors now are all like, there's many of them in the States right now. And I feel this is going to be introduced more in our part of the world, because here I feel they're more like herbalists or alternative medicine, but they're not, maybe some of them are not doctors. I like that now there's the term that he's a functional medicine doctor. And now in the States, like, you're having wards that you have a full like you have like there's a section in the hospital for that, right? Or not yet?
Not yet in the hospital, but there are a lot of people now that are seeking functional medicine doctors. And I actually was recently in Egypt for that reason, because I feel like it's this just untapped area of health that we really need to focus on. Because, like you said, in the Middle East, there isn't a lot of that, right?
Mm-hmm.
But I predict in the next 5 to 10 years, gut health will be the forefront of everything in medicine.
I agree.
We're starting to see so many studies now on links between gut health and Alzheimer's, gut health and Parkinson's, gut health and so many other issues. I mean, our study showed gut health and COVID, and now it's being studied by a lot of other doctors globally. And I have to say, I'm like really happy about this. My husband's an ICU physician, as I mentioned. They follow, like a lot of the critical care doctors follow the protocol of it's called Frontline Critical Care Alliance.
Mm-hmm.
And so they update their protocols for COVID, and they just added probiotics, including bifidobacterium, on protocol. Yeah, which is great. I mean, we've come a long way from May of 2020, where really nobody believed us and it was almost just like a mockery. We were trying to really get this out to the news, to today, fast forward, where it's now as part of the protocol. So definitely, and I'm not recommending probiotics as the panacea.
Solution.
Yeah,
Just a preventative way. So if you have to give advice to some people who are watching right now, what are like 4 things you recommend for them to have in their daily regimen in terms of vitamins that are, like, let's say, that fit the majority? Because you can't, of course, say take this vitamin and take that. What are 4 things or 3 things that you recommend to have in your daily regimen?
Yeah. Number 1, I would definitely say eat a lot of plant-based foods. I mean, that to me provides like the number 1 way of, vitamins and fibers. So at least 5 servings of fruits and vegetables a day. That will really make a huge difference. That's the number 1 thing. The second thing I would say is take a probiotic, especially one that has bifidobacterium in it, because we've seen so many studies that show its benefits. Number 3, I would say definitely check your vitamin D levels and make sure they're optimal, because vitamin D not only works as a vitamin, it also works as a hormone, and it also works as a gut helper. It definitely helps with a lot of pathways in the immune system in the gut. And if we're deficient in vitamin D, as we're all seeing in the news, a lot of people are getting sicker from COVID. So definitely check your vitamin D levels.
Vitamin D, you said vitamin D, a probiotic, greens.
Yeah.
Give me a 4th. What about zinc?
More? Sure. I would say magnesium. Magnesium is a mineral that literally is, it helps in over 200 cellular functions. And the problem with magnesium, as you probably, when you spoke to Dr. Cole, is magnesium, unfortunately, the tests that we're checking for magnesium check the magnesium levels that are outside our cells, instead of the magnesium levels that are inside our cells. And we only start to have really, really, really low levels outside our cells when our intracellular, so the magnesium in the cells, is depleted completely. So a lot of us are walking around with very deficient magnesium levels and not even realizing it, and the blood tests aren't even showing it. So what I say is definitely check with your doctor first, because you want to make sure your kidney function's okay before you start taking magnesium pills. But if your kidney function's okay, definitely add magnesium to your regimen. I take 400 milligrams a day of magnesium. It also helps with headaches. It helps with constipation. It helps with so many. Yeah.
Another thing, what's the bacteria? What do you want? The probiotic has to have what? Give me the name of the.
Sure, I text it to you too. I'm actually in the process of making a probiotic line because it's so crucial to have. There are other bacteria that they've studied that help with weight loss too, as well as other immune functions. But the one that I'm mentioning it's called bifidobacterium. Bifido. BACT.
Bifidobacteria.
Yes. Yeah. And actually, since you're a new mom, bifidobacterium, there's several different strains of bifidobacterium. One strain, Bifidobacterium breve, is only present in breast milk. And this is why breast milk is so healthy for babies, because B. breve has been shown to really help with gut health and gut healing. So babies that have, that get breast milk, and even I know there's so many moms that say, I really can't, and it's hard, and I have to get back to work. I would say at least give your baby that 1 week of even the colostrum, because that has so many antibodies in there and so many rich.
A question while we're at it, since I just got vaccinated today, I don't know if you saw. So
Yes.
what's your and I got COVID while I was pregnant. So what's your feedback about breastfeeding right after taking the vaccine? Honestly, like it just makes me sometimes overthink.
I haven't really thought about that. I think breast milk in general has so many good things in there that I wouldn't necessarily stop.
Some people tell you have to stop for 5 days and then go back again. It just makes me, there's not one right answer. You know what I mean?
Yeah, and I'm not sure, to be honest. And I don't know if there have been any studies that show vaccinated moms and breast milk and whether or not.
Yeah, exactly. So that's the thing. It makes me wonder, like, do I have it in my immune system that already that my son has it, or do I have? It just makes me wonder. And another thing, while we're at it, a lot of mothers, and since I have a lot of friends that actually, there are so many COVID babies actually, have been speaking. They say that like after delivery, everybody says, oh my God, if you breastfeed, you're going to lose all the weight very fast. And then there are so many people that tell you, no, it's not. It's like it's just a lie. I'm actually gaining because I'm eating more because I'm hungry. And then there are people that are like eating cleaner than the norm and breastfeeding and working out, where the weight just stands at it just stops. You stop losing, and for quite some time. And it's not like she's eating, like I'm not eating bad. My friends are not. What is this standstill?
Yeah, well, I mean, your caloric needs definitely go up when you're breastfeeding because you're making milk, right? So you need more than normal. However, the problem is you don't, like, a lot of women don't know how much more they need. And you're like you said, and I had this issue too, like you're so hungry, right? Because you're making milk and so hungry. So I would say, honestly, don't worry about losing weight while you're breastfeeding. Just nurse your baby, try not to gain weight. But just nurse your baby, eat when you're hungry, and eventually after you stop breastfeeding, the weight will come off. If you
it doesn't really help. So breastfeeding does make it harder to lose weight, right?
Well, in some people, if you're actually watching what you eat and you're not as hungry, you can definitely lose weight while nursing. But the problem is the caloric needs vary between different women based on their weight, after pregnancy and after delivery. So I say if you count calories, you can say, I'm going to eat 1,800 calories while breastfeeding, and then you could probably lose weight on 1,800 calories. Okay, or a little bit more. But it's hard. It's hard because, you're nursing, you're eating more, you're hungry, and there's all this other stuff going on. You're not sleeping well. So a lot of factors play a role. So I always just say to moms, like, don't be so hard on yourself. You just had a baby. Just eat if you're hungry. I mean, don't overeat, and eat healthy stuff. If you're eating healthier stuff, you're probably not going to want to eat as much. And that's
as much as I try to be this positive figure of, love your body. You just gave birth. It took you 9 months to get pregnant and give your body 9 months. As much as I like to say it and I like to hear it, realistically, it is a battle to be bigger than your norm. So I know you went through a struggle with weight at some point in your life, so I'm sure you feel it, because it's easier said when it comes from someone that's very skinny, that's like in her 60s after she delivered. You're like someone in your 50s and suddenly you're in your 70s. It's very hard to accept this change. So I saw your picture before, and I'm like looking at you right now, mashallah, yani seriously, that's just a transformation. Really, the great job.
It's intermittent fasting. I started doing it when I was a teenager, and at the time people thought I was crazy. But when I was in medical school, I was studying the pathways, right? All the different biochemical pathways. And I was like, I'm going to try this. I'm going to fast for 14 hours and see what happens. And that's really what kind of helped me lose weight.
14 or 16 do you recommend?
Honestly. So at the time I was doing 14. But it really depends on your body. You could try 16, you could try 14, you could try 18. I now currently, for me to lose weight now, I have to do 18 hours. But I usually do 14 to 16 to maintain my weight. But that was the only thing that really helped me lose weight, was intermittent fasting. because it's, you know, if you think about how it works, your body just has these other mechanisms of fueling your cells that don't necessarily come from food. And, you know, when it gets to the point where it's going to fat cells to burn fat to get those ketones to your cells, that's when you know you're burning calories. And so, you know, you were mentioning like in the morning you're hungry when you wake up. That's because you've been fasting the night before and your insulin levels dropped. So when your insulin levels drop, it kind of alerts your body like, okay, what are you doing? Are you going to eat something so that I can help get the glucose to cells, or what are you doing? So usually most people are like hungry for like a few hours, but then if you ignore that hunger, usually it goes away, because then your body,
it's like when you fast in Ramadan. Yeah, like for me, the easiest thing in
yep,
Ramadan, which is for me, it's not hard to fast. What's hard for me is I just get thirsty.
yes,
And I
yes,
always make sure that Ramadan for me is the best month to lose weight, because I actually work out right before the iftar, which is when we break our fast. So I
yeah,
work out like at say 5:30, then I just come home, shower, then I go to
eat.
eat. But usually I go eat very badly because I'm starving, and the food is like, you know, it's like our festive season. You're from Egypt, so I'm
Right.
sure you know.
Right.
Um,
So do you, when you fast for Ramadan, so do you feel less hungry later on? Like
Actually, no.
okay?
I'm someone that doesn't eat. I eat one meal in Ramadan. I don't eat the late
Okay.
night.
Yeah.
We have fatur and then we have sahur, which is the late night
Right.
meal, 12 a.m. And personally, I don't eat at 12 a.m. or 2 a.m.
Yeah.
because I will
It's
gain
hard.
so much. So I kind of go crazy at the breaking fast. Like I really go crazy. But
Yeah.
honestly, I don't gain weight, but or I would lose. It depends on my intake. But at the end
Yeah.
of the day, after this month, I am always down 3.5 or 4. If I didn't lose well that month, I would lose only
Yeah.
2. But I don't gain, which I
Right.
love. So I do
Well,
the same thing here, but I'm
yeah,
a big
and that's
eater.
how your body works. Your body is, you know, using other methods to fuel its cells while you're not eating, which is great. So, and
By
that's
the
what
way,
you
do you
want.
speak Arabic, by the way, or
I,
no?
I speak a little bit Egyptian Arabic, which I don't know. Like a lot of people don't understand
No,
Egyptian
I
Arabic.
understand. No, by the way, I'm from Jeddah. We're very my city is we're on the Red Sea, so we're
Okay.
very close to Egypt, and we of course understand Arabic. By the way, all Saudis grew up watching all the Egyptian movies, the Egyptian shows like Adil Imam and all that. And also we, because I'm from Jeddah, we're a melting pot of origins. So
Yeah.
molokhia, the food you eat in Egypt, is very common in our part of in our city. So
Okay.
you see a lot of similarities in culture
Definitely.
among my city and Egypt in general. But in general, Egypt is very close to Saudi in terms of everything, in terms of cinema, our teachers, everything you cannot imagine. It's so
I
close to home.
all the regions in the Mediterranean have this culture that kind of blends them all together, right? Like Greeks, like I have a lot of Greek friends that are also very similar to Middle East.
Very like I find Greeks and Greeks the most similar to the Middle Easterns, and then maybe
Agreed. Yeah,
and Turks not even. I find Greeks more. Imagine.
I'm with you. Yeah, definitely.
Even the personality, although I have Turkish blood, my great grandmother is Turkish, and but I still, therefore my mom's blonde, if you saw in the car. That's but in
I,
general I find that there's a lot of similarities with the Greeks. And I also find even when I went to college in Boston, Latins, it's just the hot bloodedness of the Latins
yeah,
fit the
agree.
Arabs very
Agree.
well.
Anyone with like sun and you know warm climates, we all have this
I don't
soul
know.
about.
Yeah, there's a lot of soul and personality, and it's very lively, you know.
I
Like
agree.
there are some cultures that you find very cold sometimes, maybe, but like Latins and Arabs were always friends in college, always like a group. We had like a cult.
I,
Yeah, I have a
I,
lot of Egyptian friends, by the way, in
do you?
Cairo, a lot, and
Oh
I.
wow. I was just there a few weeks ago, and we actually went to the Red Sea for a few days. It was like the best trip I've had in a really
Yes, you
long.
went to Sahel. Or
We actually I went to Guna.
I went to Guna. It's so nice. I actually my friend got married there.
Oh,
It's so
very nice.
pretty.
Yeah, it is.
Egypt is beautiful, and I honestly, like, my father is actually there now. We have a place there. Yeah,
Okay.
but I've never been to the place he bought it like right before COVID, so I've never been yet. But honestly, I'm curious.
Where
I'm
did he buy it?
excited to go.
Where did your dad buy in
I think
Cairo?
it's next to. I think it's in Giza. I think it's in
Oh, okay.
Giza.
Is it Sheikh
Yeah,
Zayed?
Yeah, because when I was young, my dad used to work in a company, and he actually lived in Egypt for 4 years because that's where
Okay,
he managed that area. So we used to go to
got
Egypt
it.
so much as kids. So it was like home, but I haven't
E-
gone in a while.
Yeah, well, you've heard the term Masr Dunya, right? Like
مصر
Egypt,
أم الدنيا
mother
طبعا.
world.
That I probably speak Egyptian better than you. You'd be so surprised.
I don't know. My Egyptian's pretty good. My Egyptian Arabic is not
No,
bad. Yeah.
my Egyptian Arabic is very good because like I grew up watching all the soap operas in Egyptian, all the movies in Egyptian, all the plays. I used to go to plays live, in Egypt.
That's
So
awesome. I
you
love
have to
that.
know that we have such love for Egypt and Saudi because like I swear this was Egypt. The Egyptian cinema was or it still is the cinema, in the Middle East.
And there's something about Egypt. I mean, my husband's not Egyptian, and he and my children, we went to Egypt literally right before COVID hit, like in February of 2020.
Yeah.
And he was just he loved it so much. And he said of all the countries that we visited, and we visited so many countries, he said Egypt has the most history, just the most you've ever seen in a country. And he said it's funny because like the tourism like really needs to be amped up. So he was joking, he's like they should hire the folks from Disney to come to Cairo and tourism properly.
Where is he
But
from, by the way, your husband?
he's like just American, like his family ancestors have been in the US for like 300 years. Like he has some Scottish, Irish, Polish, Russian background,
A
but
mix. He's a
he's a
mix.
mishmash, yeah. So my kids, I'm like pure Egyptian. I have a little bit of Greek, but like my kids are now like mutts because they have like a bunch of his,
Amazing.
yeah. But they all
Like
look
I
Egyptian.
have, but by
My
the way, I
genes
think
are
it's
strong.
everywhere. I think everywhere is a mix. Everyone's a mix. Like like my
It's
father is
true.
half Syrian, his mom's Syrian, and then my mom is Saudi on both sides, but her grandmother is Turkish. I think it's if you do a blood test, and these tests they
Yeah.
do now, like everybody that does this test has blood from somewhere that's very different from where
Right.
they think they're from.
Did you
Yeah.
ever do it? Done the
I
DNA
haven't
test?
done it yet, but my friend just did it, and I'm curious because
Yeah.
apparently it keeps changing after the more they do research, the more it gets updated. But I'm
Yes.
definitely gonna
Yes.
do it. I'm sure I have African. I'm sure I have something. I'm definitely gonna do it. I'm excited, but I'm so happy for
Yeah.
this live, and I would love to see you when I come to New York. Because I come a lot. I'm just
Absolutely.
doing my visa right now.
Okay.
Let's hope the
Love that.
world stays open. Let's just hope
I know.
for no on with what's happening. It's scaring me.
I
Do you think we're gonna have another round of lockdowns?
I'm really hoping not, because historically speaking, viruses that mutate usually are weaker forms of the original virus, and we saw that with Delta, right? I mean, Delta was a weaker form of the original, SARS-CoV-2 virus. So I'm
Yeah.
hoping new mutant that's out is just even weaker, and it's not going to cause a problem. But we're going into the winter months, so that's the only fear. But I have a feeling it's not going to be as bad, and I think we have a lot of herd immunity now, and a lot of people vaccinated, so hopefully we won't have an issue. But fingers crossed, because my daughter is actually planning on doing a spring semester over in Egypt, if her university here
Because they
approves.
closed like 6 African countries this
I
month.
Yeah,
I think in Dubai and in Saudi. I don't know about the other countries yet. So it's
yeah,
kind of worrisome because it's starting with Africa this time, which was not, and
yeah,
now Europe, apparently Austria, and I don't know about
right.
Germany.
Yeah, I think they're just being like extra cautious. I don't know if their ICU numbers have increased or not, but I think they're just trying to be extra cautious because of the winter months and because they don't know whether or not the vaccine immunity is going to transfer over to the new, mutation. So I personally think it's not going to be as bad, but we'll see. Time
But by the
will tell.
way, next trip you have to come to Saudi. It's time to
Absolutely.
come to Saudi. Really, like honestly, not because I'm from there, but really, it's a beautiful country. And I'll be honest with you, I'm exploring it myself, being Saudi, because
Very,
that is huge. So I feel like the past couple of months, because I was pregnant and I couldn't travel, I
yeah.
visited places in my country that I think I'm like, oh my, I was amazed. So
Wow.
really, I think it's time to visit Saudi in the future.
Absolutely.
There's a lot of opportunity there. So maybe you come and do some, like maybe you can open your clinic there at some point and do consultations at some point. But now you
I'd
can, but
love to do that. I'm thinking of like a wellness retreat, even, where you just escape from your whole family or
just take a
whatever.
break.
Or take a break, do a few days of wellness.
But
So
tell everyone that you can do online consultations, right? You can do
I
that.
do. Yeah, I can do definitely a lot of online wellness evaluations. So anyone that wants to see what their like dominant neurotransmitter is, or if you're deficient, we can definitely do one. And I recommend specific foods and specific natural supplements to help you increase those neurotransmitter levels naturally. And I must say, like, a lot of people really see a huge difference just from a little bit of tweaking, you know, with your food and lifestyle. So our body is the best healer of all. No medication is better than our body's ability to heal. We just have to feed it properly. So.
Okay. Thank you so much, Dr. Christine, for your time. And hopefully I'll see you in New York soon when I come.
Definitely let me know if
And
you
it will
come.
be my pleasure, honestly. And
Really,
have a beautiful evening.
you will. Take care. And good luck with the babies.
Thank you. Thank you. Thank you so much. Take care.
Bye.
Bye.